All right, welcome to my second video, just outlining my journey with hip labral tear and femoral acetibulum impingement. I think I got that right, FAI. Made a video, my first video just kind of laid out the symptoms and signs that I had. I pretty much went through about a year and a half of pain and issues leading up to my decision to ultimately get the arthroscopic surgery to get my labral tear repaired and get that bone ground down and remove that impingement. So this, sorry, this video is just going to kind of go over the day of surgery, what that experience was like, and pretty much take you up to where I'm at today. So I'd never had surgery before in my life, so this was very, very scary for me, especially just the thought of being put to sleep. I would say that was probably scarier for me than the surgery to my hip. So the surgery was August 24th. Went in, had to be there at 5:30 in the morning. This is an outpatient procedure. Left hip, torn labral, showed on the MRI to be about 1.2 centimeters long. There was another little area that was about 2 millimeters long that he wasn't sure what that was going to kind of discover as he got there. And then also shaved down the impingement area so it would stop kind of rotating into my socket area and tearing the labral even worse. So got there August 24th, 5:30 in the morning. You know, pretty standard, what you would expect. The nurse came in and talked to me. The doctor came in and talked to me. The anesthesiologist came in and kind of reviewed what his plan was, which one thing I found interesting was he did a regional anesthesia as well as a general anesthesia. So the general anesthesia is where you're put completely asleep. The regional is where they block pain to a certain region of your body. So from the hip all the way down that whole leg. When they took me back, they actually stopped in a room before the operating room so that he could do that regional anesthesia. And that was most unpleasant. He apparently had a hard time finding the nerve ending. And if you've ever had that done, it kind of feels like you're being shocked over and over and over. So I was squirming on the bed and he was like, you know, try to lay still, try to lay still. And I'm like, are you shocking me? What are you doing? Why does it feel like you're electrocuting me? And he's like, I'm not, it's just what it feels like. You know, they just had a hard time finding it. Ultimately they did though, so it was fine. I think it probably took them, I don't know, 15 or 20 minutes, but it, you know, it hurt, but it was fine. And in that room, I said, you know, is there anything you can give me for my nerves? Which oddly, I wasn't that nervous. And that's pretty odd coming from me because I've always been very afraid of just doctors and surgeries and medications and all of that. But I didn't want to get in the operating room and start to panic. So I thought it would be a good preventative measure to just give me something now so we can prevent that. So he agreed. They put something in my IV. Within seconds, the room was spinning in a good way. So I was like, okay, I feel calm. This is good. From there, we went into the operating room, and the doctor wasn't in there. It was just him and the anesthesiologist and a couple other people. And he was putting something in my IV, and it was burning really bad. And he said he was just, I don't know what it was. He's putting in some kind of medications. And he said, I'm going to give you your sleeping medicine now. And that was the last thing I remember. It's interesting because when I hear about other people who have gotten surgery, they say you know, the anesthesiologist said to count down and they only remember getting to 7 or they only remember getting to 8. None of that. It was lights on, lights off, out. And next thing I know, I was waking up in the recovery room. So when I first woke up in the recovery room, and I don't want to scare anybody, but I was in excruciating pain in my hip. It was really probably the worst pain I've ever felt. And the nurse said, you know, Kim, wake up. And I woke up, and that was the first words out of my mouth was, oh my gosh, it hurts so bad. It hurts so bad. And she was like, that's interesting. Thinking back that I had the regional anesthesia, I'm not sure what happened because from mid-thigh down to my ankle was completely numb for the entire next day, like it was dead. I couldn't feel anything. So I don't know if maybe they did hit the wrong nerve ending and it didn't numb my hip, or maybe it did and it just still hurts that bad. I really don't know. But you know, she said on a scale of 1 to 10, how bad does it hurt? And I politely said 10. I wanted to say 50. And then she said, well, let me help you with that. I would assume she probably put some kind of pain medication in my IV. Within probably 15 minutes, that was under control. I mean, it still hurt, but it was more bearable than what you would expect pain-wise. So from there, they, you know, got me the rest of the way awake. They rolled me back to my original starting room where my husband was anxiously awaiting. So I was very happy to see him. And just kind of went through the journey of trying to get me to wake up all the way, get my clothes on, get me ready to leave. But then I started to get really, really nauseous. And the problem was every time they tried to sit me up, I would start to feel like I was going to get sick and maybe even black out, and they'd have to lay me back down. And this went on for maybe an hour, I don't know. And they were very anxious to get me out of that hospital, maybe because of COVID, I'm not sure why, but they were very, very anxious to get me out of there. And every time they would try, I would start to feel sick and have to lay back down. So they brought me nausea medicine, which didn't do much. It's like a pill you put on your tongue and it melts. And then they brought me some kind of nausea stuff that you sniff, which seemed to help a little. But ultimately what got me out of there was another nurse came in. Maybe he had a little more experience, I don't know, but he said, I'm going to give you a little oxygen, and this will hopefully make you feel well enough to get into the wheelchair. And it worked. So I don't know if that was a placebo effect or what happened, but when he gave me oxygen, I had enough to get in the wheelchair and actually make it out to the car. Got in the car. We only live about 15 minutes from the hospital, so got home pretty quickly. I didn't get sick or anything. Got in bed and very nauseous the entire day. So nauseous. Did end up actually getting sick a couple hours after I got home. And my throat was so sore from the tube that they put down your throat to assist your breathing when you get general anesthesia. I would assume it's probably something like a respirator. I don't really know. But my throat was so scratchy and so sore, and it took like 3 days to get past that pain, and just constantly clearing it and using like Hall's cough drops to ease the pain and things like that. But it got better. That was the least of my concerns, I'll say that. But it was there. Another great thing that they gave me was this ice machine. It's called, I'm looking at it now, it's Breg. And it's like a cooler that you sit on the ground and you fill it with ice water, plugs in, and it pumps water through a tube that goes up to like a pad that you put on your hip. That by far was the greatest thing they could have given me, because you have to keep ice on it all the time. It's so convenient. If you're going to get the surgery and they don't offer you that, I would recommend going on Amazon and buying one ahead of time versus trying to use like bags with ice in them and all those kinds of things, because they're messy, they're inconvenient, and this thing was an absolute lifesaver for me. So highly recommended. They sent me home with pain pills, anti-nausea pills, baby aspirin, and naproxen, which is a pill that helps you not build calcium, I guess, on the bone as it's healing. So, you know, pain pills, I felt like part of the reason I was nauseous was just from all of the combination of pills that they had given me and the anesthesia. So I really just wanted to flush all of that out of my system. So I called the doctor the day that I came home from surgery, and I said, listen, I don't really want to take these pain pills. Can I just take some Advil? And he said that was fine. So I took 3 Advil that night, and I took 2 Advil the next day. And that was the last pain medication that I took, even to today. So the pain, very manageable, not bad at all. When it starts to get a little achy, I put my ice pad on it, and within minutes it feels better. So it's just not been a problem really for me at all. The baby aspirin I still take twice a day, and the naproxen I take twice a day because those are pretty important to stay on. Those have been going well. And all in all, you know, it's been good. I went for my first post-op yesterday. I had my stitches removed, and I got to see photos of the actual surgery, which I can upload for you to see here. That's pretty cool. It shows all the anchors and shows the head of the femur and everything that they did there. And still on crutches. I'm going to be on crutches for a month. I can't put any weight at all on my leg for a month. So crutches are terribly inconvenient, but I tell you, I went on Amazon and got a couple things to make it better. I got a kit that had the top pads, the handle grip pads, and this little pouch. And the pouch has been an absolute lifesaver just for little things like even going to the kitchen to get a bottled water and you don't have any way to carry it back because you have to use your hands on the crutches. So I'm able to put, you know, bottled water and snacks and my cell phone and little things in there that really made that a more bearable experience. And my hands are really bruised from the hand grips of the crutches, so I don't go more than I have to on those just because it hurts so bad. I do still have my compression socks on. I have to wear them for 14 days total. So I'll get to take those off on Monday. Super excited about that because if you've ever worn compression socks, they're pretty miserable. So I'm excited to get them off. I get to start physical therapy Wednesday. I'm really looking forward to getting in there and just moving my hip for the first time and seeing what it's going to feel like. You know, I haven't been able to move my hip really at all in any direction, so I'm just anxious to see, you know, if I can go left and go right and pull it up and different things and just get it moving around. I will continue to post videos and just kind of keep you guys updated on my, probably weekly as I go to physical therapy and just kind of give you updates on how it's coming. I know it's going to be a long, hard recovery, but I already see positive signs. I already see pains that I had before that I don't have anymore. So I'll keep you updated, and if you want to follow along, you can just hit the subscribe button, and we'll talk soon. Thanks.